will be your chair for today, along with Judith Thompson. The aim of today's session is to talk about how people with learning disabilities access screening services and share some of the good things that services have been doing to make screening services better.
Hi, so I'm Dominic Slewey. I'm the National Clinical Director for Learning Disability with NHS England. Today we're coming together to really look at one of a number of health inequalities that people with learning disability experience. So when we're talking about health inequalities, what we mean is that people with learning disabilities have worse health, worse care, on any measure that you particularly want to look at. But today we're looking at cancer, and we're looking at how people with learning disability get access to those three very important screening programs to try and prevent them getting cancer, to catch it at a stage where something could be done about it. Now, the reason that's so important is that we know that people with learning disabilities die at much younger ages than they should do, and that there's many things that could be done for them to help them live longer and to help them live fulfilled lives. And so today we're just looking at what it is we need to do and how we need to do it. And that's on the back of some really great work that's been happening in the northeastern Cumbria over the last year.
Well, I think that these events are the only way to move the agenda forward. And today we've had people from the National Inequalities, Public Health England. We've got national leaders from NHS England here, regional leaders. And so to bring local people that are working in the services together with people with learning disabilities and bringing people together from regional, national levels, it really does work. And that's what you need to make a change.
Well, what we've got is a range of people with different experience and different ideas in this room, and they are sharing their ideas. They've come up with a set of priorities that they want to see happening, and now they're just working through some of the practicality, how are we going to do it, who's going to do it, by when are we going to do it. So what I expect to see at the end of this session is some really good ideas about who could do this, how might we do things differently. And basically we're all trying to make for a better experience and to get more people to come forward for screening. So that's what they're working on.
This is a really exciting day for the North Eastern Cumbria Learning Disability Network. We've been working on this project now for about 2 years and we have been working as part of the ACE programme. So ACE stands for Accelerate, Coordinate and Evaluate, and it's a national programme that NHS England.
Hello, my name is Judith Thompson and I am the North Eastern Cumbria Learning Disability Network Manager. Today I think I tweeted very early on this morning to say that I felt as if we were at the start of a very exciting day, and indeed I think we have had that very exciting day. The room has been full, it has been buzzing with excitement and enthusiasm and challenge and highlight and reflections about what we have achieved so far, but more importantly about what else there is still to do, because there is still lots more to do. This work is important because it is about saving the lives of people with a learning disability, and that's why we must organise what we've learned today, turn that into something that makes sense as a set of initiatives and objectives and outcomes that we're going to work towards, and keep the momentum going for the next 12 months and then take stock again and see where we are. But this work, tackling the health inequalities for people with a learning disability, is something that is a network and that I am personally very passionate about trying to address, and this programme is one of our big programmes, most important programmes to help do that.
Audio clicks. Be heard.